Welcome to NurseEdScholar. Thank you for watching this video. Today, I'm going to talk about 5 mistakes that nursing students make during their clinical rotations, and just some tips on how to avoid them. The majority of them, all of them actually are pretty fixable. But it's just more of being prepared. So we're going to go through those 5. All right. So to begin, I want you to know that students mess up in clinical. Being a clinical instructor, students mess up, even if they're well prepared. Just because it's new, you don't really know what you're doing. And that's why we're there. Your clinical instructor. If you're at an institution where they have preceptors in the hospital, that is what we're there for. We're there so you don't make mistakes. Okay, but we're going to talk about those five common mistakes that students make. One thing that when you make a mistake, it depends on your school, but a lot of times clinical isn't graded. You're graded and there's a rubric, but it's really just kind of a pass fail. But definitely, if you're unsafe, that's a problem. You will probably fail that clinical. But like I said, most mistakes that students make, totally unavoidable. So, I always have some notes. So let's start. Number 5, not preparing the night before. Now, at some, colleges, they've stopped going the night before. So if you're new into a nursing program, typically what happens is that your clinical instructor will have your assigned patient the night before. You will go in your clinical uniform, or if not your clinical uniform, you will dress nice with your lab coat, and you will go to the hospital on the floor, the unit that you'll be, having your clinicals. And then there you will get the information about your patient: diagnosis, labs, medications, history, and you would get all of that information and be prepared the next day to assess your patient. The labs, their recent vital signs, all of their medications. And then you could prepare for teaching, because you are supposed to teach your patient, even if it's about their diagnosis or about nutrition or about their medications or about lab values. You should be prepared to teach. Well, when you show up with absolutely no clue on what your patient's diagnosis is, trust me, the clinical instructor, your preceptor, will know. You did not put in the work. They will be upset, and that could cause you a ding or a counseling session. All right. Number 4, acting overly confident. Whew, that happens a lot. Students are very educated. They know the material, but putting into practice what you learn in class, sometimes there's a disconnect. Sometimes you may need some more time in the skills lab to perfect those skills, but no one knows everything. I think I said that in a previous video. No one knows everything. And you're pretending to know everything, especially if you're a level 1 or a second year student. There's still so much more that you have to learn. So you definitely do not know it, and that is definitely dangerous. So please, if you're unsure, ask. If you need a little more clarification, ask. You're there to learn. It's a learning environment. Even after you graduate, there's still a learning curve. So please, Avoid mistake number 4. Please don't act overly confident. So, before we go on to number 3, tell me something awkward, an awkward mistake that you made in clinical. It's all right, because this platform is to help others learn from others. So, you're teaching the next generation of nurses. So if something kind of weird happened, drop it in the chat so other people can, learn from your experiences. But because understand, you're not alone. All right. So let's go. Number 3, ignoring the CNA. Okay. The nursing assistant or any support staff. I will tell you, your CNAs are the eyes and ears. They are your best friends. If you act like they're invisible, if you don't take what they're saying to you, understand you're a new student. This individual has been on that floor. They know those patients. If they tell you that their vital signs are off, believe them. Go and check them. Because we're supposed to check if they have an abnormal vital sign or there is a change in their condition. Once they report it, we go and assess our patients. Do not blow these individuals off. You will need them just like you need the other nurses on the floor. I promise you, you will have a very difficult shift, guaranteed. So understand, respect. It's all about respect. Respect equals teamwork. Very valuable. Okay. Now we're moving on to mistake number 2. Ooh, that bad body language. Hands in your pocket, slouching, face all scrunched up. Definitely no eye contact. You may be confident in your skills, but your body is telling a totally different story. If the clinical instructor can see that, your classmates can see that, and definitely your patient is going to see that. If they see that you are avoiding eye contact, patient's going to be like, what, they don't want to take care of me? Is something wrong with me? Because the patient will think that. If their hands in your pockets, your clinical instructor is going to say, oh, they didn't want to come to do any work today. Hands always in their pocket. They're not looking up the medicines. They're not trying to go into the EHR, so electronic health record, to see if there's any new developments in their patient that happened overnight or early morning before we got there. Your presentation is everything. Please, and especially those cell phones. Everybody has to have a cell phone, especially if you have children or expecting a call. And clinical instructors, they understand. But when you're standing up in the middle of the unit on your phone, not tending to your patient, not looking at your meds, not gathering the information for your care plan, big mistake. Do not do it. I'm warning you. Please. Please be present and engaged. Let's see what else. We're down to the number 1 mistake. I didn't know we got there that fast. So what did we go over? Not preparing the night before, acting overly confident, ignoring the CNA and support staff, that bad body language, and now we're down to number 1, not connecting with your patient. That is why we're there. Like I said in another video, we are our patient's advocate. As a student, you may be so focused on, I need to gather the information. I need to prepare the chart, or I need to prepare to pass meds. But if you don't connect with the patient, you have missed the most serious part of nursing, the human aspect part. That's why we're there. That soft voice, that encouraging voice, the voice of understanding, of empathy. That is why we're there. You know, that eye contact that we have with our patients. You know, sometimes they're hearing bad news. Just standing there, holding their hand, means the world to our patients. So please avoid that number one mistake. Please connect with your patient. All right. So I've already given you the 5 mistakes that nursing students make while in their clinical rotations, but they're fixable. Prepare ahead of time, be humble, respect others, and show up with intention. That's what it's all about. And when you do that, your clinical instructor will know, your preceptor will know, and they will be so proud of you. So, you don't need to be perfect in clinicals. You just need to be, like I said, you need to be present. You need to be willing to grow, willing to learn. So if you like the content from, this video, please like and subscribe. I'm going to have some content. I'm just trying to throw some nuggets in of just growing as a nurse, some tips for you to grow as a nursing student, because you got this. You got it. But please subscribe for more nursing tips. I'm NurseEdScholar. Thank you so much for watching this video. And until next time, happy studying, happy learning.